Hi everybody. So it's Q&A Friday. So we've got 3 questions today. I don't know what happened, but that was okay because it was a very much information-packed question. First one comes from Cynthia Hildreth. Hi Cynthia again. She asks, what stage is lupus research right now for a cure? So for so long, we've only had for lupus a general immunosuppressive agents like corticosteroids and various chemotherapeutic agents to try to suppress all of the immune system, which was really bad for us. And that's why most of us have secondary issues as a result of those toxic meds. But since probably about the last 5 years, we've got this new drug called Benlysta. And I hear that there's more research and more medications coming, specifically targeting the specific immune modulating cells. And Benlysta targets the B cells in our body. So basically, Benlysta inhibits our B cells, which are B cells are responsible for normal immune response, as well as the pathological autoimmune response as seen in lupus patients. You guys, really, really complicated biochemical pathways here. There's just a lot of receptors and there's a lot of activators, and then there's a lot of inhibitors, and a lot of the medications are targeted for a specific pathway or a specific enzyme that inhibits certain things to modulate the whole immune response. But the problem is that when you fool with Mother Nature like that, you are going to have unintended consequences, which can be sometimes ending up in death. So, while Benlysta works great for many of us, and as many of you know, I've been on Benlysta for a while. I am going to stop as of next year, probably. This is probably my month. I want to say 18 months I've been on it. After 3 relapses with my nephrotic syndrome, severe kidney nephritis, I didn't want to risk having another flare. I just don't feel like my body can handle another flare. Knowing what I know about the Benlysta, though, I want to stop because there's no long-term research to validate its true efficacy, if you know what I mean. The side effects are too scary for me at this point. I think it's done what it can in my body. But it's important to note that specifically for African Americans or for those of you who have severe kidney involvement, it hasn't been tested. And there's been a lot of deaths in these studies in patients who were on Benlysta for a long time, or in some of the subjects that were on Benlysta trials. So all that to say, we don't know what it's going to do, but what I do know that there is a serious genetic makeup for you and me, for everybody, every one of you watching this or in this group or anybody who has autoimmune conditions. We all bring to the table our genetic individuality. And your immune system, my immune system works differently, is why when you do go to your rheumatologist's office, everybody sort of presents differently. And so I don't think that this is a long-term thing. So Cynthia, when you ask me about the cure and then the research, to me, when you talk about the cure, I talked about this in the past, when you talk about the cure, it's the pharmaceutical and the medical research teams going after a specific medication that they can patent, and they need a lot of money to kind of conduct these tests. And when they do, it's expensive for the insurance companies as well as for us patients. The Benlysta medication alone is $28,000 a year. And it's a very, very expensive medication. What I do and can tell you for sure is that there are supplements and vitamins and herbals that do the same thing and block the same pathway. But when you're using more of Mother Nature, like nutraceuticals and herbals that come from the earth, it's not bioengineered in any way, we're able to reverse the inhibition, so to speak. If we have an impact in our body, as soon as we take it away, that can be reversed so that we have healing properties, so that we help our immune system to do its thing. But when you're bringing medications to the table, oftentimes we're finding that when we shut off the immune system that way, we can't reverse that. So we have to live with sort of the consequences or effects of such medications. So I did include here a little trivia on Humira, okay? Everybody who has rheumatoid arthritis, there's probably many of you in this group who are on Humira. Humira is a human monoclonal antibody specific for RA. And in 2013 alone, retail sales were $5.4 billion. Humira inhibits the cytokine, a specific cytokine in the same way that Benlysta does, that's specific to RA. So, and it's the the best-selling pharmaceutical in history, right? So it costs a patient $3,100 a month to take Humira. And again, there's herbals and nutraceuticals that can have the same similar impacts. But why that's not being studied? Because it's not patentable. There's no money in it. So it's just really, if you ask me, it's just monkey business here. So that's what I think of it. Like, as I mentioned, I was on Benlysta to save my life and to make sure that I get things back in order. But I am very vigilant about when I'm going to stop and be in conversation with my rheumatologist, which I have a greatest one. And I hope all of you can have a great rheumatologist, but I'm finding that many of you have not so supportive rheumatologists that are really pushing drugs. And I've had a number of rheumatologists that I've had to kind of break away from because of the threats that I've got, stating that if I don't take corticosteroids or certain chemotherapeutic agents, that I would end up dying because of my disease. And I just didn't want that kind of a conversation with a physician who's supposed to look out for my health. And I completely disagree. And I've gotten off of all my medications and I'm doing perfectly fine, if not better than most who don't have a chronic illness. I stand here in front of the camera every week to show that there is a way. I know too much to be quiet anymore. So I'm going to continue to share snippets with you. Okay. Number 2 question comes from Catherine Contreras Acosta. I hope I didn't bastardize your name. Hi, Catherine. She asks, is mycophenolate a chemo? Well, you can say that it is chemo. Most lupus meds work to suppress the immune system, as do the chemotherapeutic agents for cancer. And that's why a lot of the lupus patients, you know, the side effects to the medications are cancer, which is ironic, right? But, you know, mycophenolate is basically generic for Cellcept, and it was used for patients with transplants, organ transplants, so that your immune system doesn't reject the organ transplant, specifically kidney. I've been on it in the past, but usually it will be coupled with Cytoxan therapy. At least that's what the protocol was back then, many, many years ago. Now I understand that Cellcept is a standalone, I guess, medication of choice for those who have active kidney disease due to lupus. So that's what I know of it. And again, the side effects are pretty scary, in my opinion. So I would do some research and ask and speak with your rheumatologist to make sure that this is something that you do truly need. Anytime I can get away from taking corticosteroids, it was usually a good thing because it's a steroid-sparing kind of a drug, same way that methotrexate sometimes is, and Imurans and such. So talk to your rheumatologist about the potential side effects, know what you know, ask me questions about the other herbals that you can be taking, because I've got some good ones that I can share with you, okay? Number 3 is, do you have gas? This is asked by Shelly Judson. Hi, Shelly. I get tongue-tied today. I don't know why. Anyway, there's many factors here. So I've always said lupus patients typically have leaky gut, or a better term for that would be gut permeability. Why that is because if we have any environmental stressors, or even emotional stress, or stress in general from life, we can have gastrointestinal permeability issues. We do develop leaky gut, and that's evidence-based. It's shown in research. We have the risk for hypochlorhydria, which means we don't have enough hydrochloric acid in our stomach. And many of the times, doctors will give us protein pump inhibitors, PPIs, or antacids, thinking that we don't have enough. I mean, we have too much, but it's because we don't have enough. Secondary effects of that can be, the downstream effects of that can be the leaky gut, gut permeability, dysbiosis, which means imbalance of the gut microbiome in our gut, because there's a certain type of bacteria that we expect to see in our large intestine, which is different from our small intestine. And so that's when people end up having SIBO, which is small intestinal bowel overgrowth. And that can cause a lot of fermentation when you eat anything vegetable, or anything in general. Even if you take probiotics, that can flare you up in such a way. I've struggled and suffered with that for so long, and it was a very embarrassing problem. But it's a simple fix by restoring your gut. That's something that will take a little bit of a time to kind of balance. But that's where I keep talking about, gut restoration at the core. Because if your gut is not healthy, then what makes you think all the nutrients that you're taking is being absorbed? And why that's important is that any type of biochemical reaction, we need a lot of cofactors to drive the biochemical processes forward. And those cofactors are very much dependent on a lot of nutrients, like the B vitamins, CoQ10s, vitamin A, E, C, all the B vitamins, and we just don't have enough. I will share with you next week about the incidence or the epidemic of nutrient deficiency in this country alone, and it's very staggering. And for us with lupus, we're taking a lot of pharmaceutical agents too that further adds to the toxicity and the intestinal permeability, and so we've got a lot of factors that we're paying attention to, but we're really not paying attention to really making our body robust. So rather than thinking to another pill for your ill, I really want to encourage every one of you to start thinking about building your health back up in your own body, to kind of take the balance back. Because once you reach homeostasis within your body, then everything sort of will balance itself out. And that includes your immune system as well, decreasing your inflammation and, calming all the secondary effects of it. Many of you, because of all the medications that you've taken, are in a lot of pain. We're finding a lot of the pain receptors are due to not only local inflammation, but it's a systemic inflammatory problem. And when you've got a systemic inflammation, it affects just about every aspect of your body. Your endocrine system, all the hormone systems, hormones including the insulin, you end up having insulin resistance. So a lot of you might have glucose intolerance, and over time that develops into diabetes, and then diabetes causes fatty liver disease, and then the fatty liver, when you've got fat infiltrated in your body and your skeletal tissue, you're going to get fatigued, because again, that brings me back to the mitochondrial deficiency or insufficiency that I spoke about a couple of weeks ago, about how that causes, or that's the root cause of all our diseases, really, including cancer. So if you know what I know, you would trust that these are all things that's in your control to sort of reverse it. And I am a true believer that we can reverse lupus or any other disease. But once we cross the threshold, there is a point where we can't reverse a certain thing. We sort of have to do damage control. Because when you have damage done permanently in your body, then it's much harder for you to bring back and regain a sense of balance and sense of you so that you can thrive in your life. So with that, happy Friday to you, and I will see you next week.